next speaker is Caglar Emre Cagliyan from Turkey, taking us through lower modified rodent skin score values and complement 4 levels associated with arterial endothelial dysfunction and systemic sclerosis. What a mouthful. Thank you very much. Over to you.
Thank you, dear chairman and my dear colleagues. Today I want to present our study which we have conducted in patients with systemic sclerosis. And as you know, systemic sclerosis is a multi-system autoimmune disease affecting skin and multiple organs. Although immunopathological evidence supports direct arterial involvement leading to tissue ischemia in systemic sclerosis, factors associated with arterial involvement are not precisely determined due to the rarity of this disease. In this study, we aim to investigate aortic stiffness and endothelial functions in patients with systemic sclerosis. And we have included patients under treatment in our Rheumatology Department to this study. And we have looked at aortic stiffness by pulse wave velocity, and endothelial functions were assessed by flow-mediated dilation. Individuals with known atherosclerotic risk factors were excluded from our study. A thorough biochemical examination of all individuals and immunological markers of patients with systemic sclerosis was completed. All of the organ involvements in patients with systemic sclerosis were noted, and modified Rodnan skin score was calculated in all patients. And we have included a total of 61 patients and 75 healthy controls in our study. As you see, systemic sclerosis patients were a bit older than the controls, and their pulse wave velocity values were higher, and flow-mediated dilation was lower in patients with systemic sclerosis, and this was not a surprise actually. We have also grouped individuals according to severe flow-mediated dilation impairment, which is less than 10%, and none of the healthy controls had severe impairment. But in 15 patients with systemic sclerosis, we had FMD values lower than 10%. And when we look at the patient with more severe endothelial dysfunction, anti-smooth muscle antibodies were higher, complement 4 levels were lower, iron levels were higher, and modified Rodnan skin score values were lower in patients with more endothelial dysfunction. And we have performed a logistic regression analysis, and we found an independent association between complement 4 levels and MRSS values with endothelial dysfunction in patients with systemic sclerosis. In conclusion, aortic stiffness is significantly increased, and endothelial functions, as assessed by flow-mediated dilation, are significantly decreased in patients with systemic sclerosis. Lower complement 4 levels and lower modified Rodnan skin score seem to be independently associated with significant severe flow-mediated dilation impairment. Thank you for your attention.
Thank you very much. Any questions from the floor? So again, I mean, this is another area of relatively rare cardiovascular involvement of a systemic disease, and I mean, it's whilst the patient populations are relatively small in this area, it can present fundamental abnormalities. From an interventional cardiology perspective, I always find that patients with systemic sclerosis do worse, and they're much more tricky to intervene upon with stenting. I mean, clearly this is, if we look at arterial stiffness, we're detecting disease earlier. How do you think we can intervene to prevent downstream problems cardiovascularly later on for this population?
Well, these patients must be evaluated as patients with highest atherosclerotic risk factor actually. We do it in patients with rheumatoid arthritis and we actually multiply their risk factor values with some values actually. I think patients with systemic sclerosis and systemic lupus erythematosus are not different from patients with rheumatoid arthritis, and we must see these patients as maybe one of the most risky populations of cardiovascular population.
So we need to upskill rheumatologists to become rheumocardiologists.
Yeah. I'm also a
Congratulations for this good presentation. Detect algorithm has been developed and validated in cases with systemic sclerosis for initial screening regarding the tumor arterial hypertension risk. I should remind this point.
Thank you very much.
Fantastic. Thank you very much. If there are no further questions, thank you very much for another great presentation.
Thank you very much.